Welcome to the What Does Science Say channel. Imagine waking up in the dead of night, not from a nightmare, but from a sudden searing pain in your big toe. It's throbbing, swollen, hot to the touch, and so exquisitely sensitive that even the weight of a bedsheet feels like, well, like a crushing blow. This isn't just discomfort, it's the signature agonizing arrival of a gout attack. Okay, let's unpack this. Today, we're embarking on a deep dive into gout. It's a form of arthritis that's surprisingly common, yet profoundly debilitating. For anyone who's experienced it or knows someone who has, the desire for understanding and relief is just palpable.
Absolutely. And our mission today is really to cut through the noise, all the conflicting information out there, and deliver not just facts, but genuinely actionable insights. We've synthesized a stack of diverse sources, research from rheumatologists, holistic podiatrists, comprehensive scientific meta-analyses to give you a crystal clear understanding of gout. We'll explore what it fundamentally is, what truly triggers those agonizing flares, how it's diagnosed, and most importantly, both immediate relief strategies and robust long-term natural prevention.
Right. Think of this as your personalized shortcut to becoming genuinely well-informed on gout. We're aiming to go beyond just the what and really dig into the why and how.
Okay.
We promise surprising facts and practical strategies without, overwhelming you with jargon. Our goal is for you to walk away not just knowledgeable, but truly empowered to understand and manage this condition. So let's kick off with the basics.
Right.
What exactly is gout? Our sources consistently describe it as an inflammatory arthropathy.
Which sounds complicated, but it just means a joint disease driven by inflammation, often acute and, as you said, incredibly painful.
And while the classic spot is the big toe, that first MTP joint,
Okay.
right? It's definitely not the only place it hits.
No, far from it. We see it in knees, ankles, wrists, hands, elbows.
Even the lower back, I saw that mentioned.
Yes, the sacroiliac joints sometimes. It really highlights that it's a systemic issue, not just a toe problem. At its core, the striking culprit in gout is the abnormal buildup of uric acid crystals within your joints.
Okay, uric acid, no, that's a normal thing, isn't it? A waste product.
Exactly. It's a perfectly normal waste product from the body breaking down compounds called purines. Purines are natural in our bodies and in many foods. The critical point, the sort of aha moment where gout begins, is when these uric acid crystals precipitate, basically drop out of solution and settle in the joints.
Why does that happen?
It's usually one of two things. Either your body is overproducing uric acid, making more than it can handle.
Or the kidneys aren't getting rid of enough.
Precisely. They're not excreting enough, so it builds up in the bloodstream. And here's a crucial detail. These crystals are really sensitive to temperature.
Sensitive to temperature, how so?
Colder temperatures encourage them to form. That's a key reason why cooler peripheral areas like the feet, especially the big toe, which is often the coolest joint, are such common targets. It's physiology driving the location.
Wow. Okay, and when those crystals form, the pain, people describe it as just unbelievable.
Legendary, really. Worst pain of their life is a common description. Often waking them up at night, it's that intense.
But it's not just the joint pain, is it? The sources pointed to other issues.
Definitely not. Long-term uncontrolled gout can lead to tophi.
Coffee with us.
They're visible lumps, sort of white or yellowish under the skin. They're literally accumulations of uric acid crystals, a sign of advanced gout, and they can cause serious joint damage, even disfigurement.
That sounds awful.
Yes.
And there are other links too, kidney stones.
Yes, kidney stones are a direct consequence. And perhaps more concerning are the strong links to chronic kidney disease, cardiovascular disease, and even diabetes.
So that raises a really important question. What's the underlying connection here? How does a joint problem link to heart disease and diabetes?
That's a great question, and the connection seems to be inflammation and metabolic stress. High uric acid isn't just about crystals forming sometimes. Chronically high levels contribute to low-grade inflammation throughout the entire body. This systemic inflammation can damage blood vessels, affect how your body uses insulin, and put a strain on the kidneys. So it's really a metabolic warning sign, linking everything together, not just joints.
Okay, that makes sense. It's a bigger picture issue. So let's dig into the triggers. What sets off these attacks? Diet is usually the first thing people think of.
It is, and it's important. But the key isn't all protein. It's specifically foods high in purines, those compounds that break down into uric acid.
Right, so what are the main culprits there?
Well, certain seafoods are high on the list. Think scallops, mussels, clams, shrimp, lobster. Red meats, too, like steak, pork, lamb.
And organ meats,
Yeah.
liver, kidneys.
Definitely. Those are among the highest in purines. You really want to limit those if you're prone to gout.
Okay, but what about vegetables? I've heard some contain purines, like spinach or asparagus. Is that a concern?
That's a really common question and an important nuance. Yes, some vegetables like asparagus, spinach, cauliflower, and others do contain purines. However, study after study suggests they don't increase gout risk nearly as much as the animal sources.
Interesting. Why the difference?
The thinking is it might be about bioavailability, how easily the body absorbs and uses those purines. Or perhaps the other nutrients in vegetables, like fiber and antioxidants, offer some kind of protective effect that cancels out the purine impact. It shows diet isn't always black and white.
Gotcha. So, beyond purines, what else in our diet is a trigger? Sugar comes up a lot.
A huge factor, often underestimated. High fructose corn syrup, in particular, found in so many processed foods and sugary drinks like sodas and even some fruit juices, significantly ramps up uric acid production.
But what about fructose from, say, an apple? Is that the same?
Good distinction. No, fructose from whole fruit seems to be different. It comes packaged with fiber, water, and other nutrients, and the body processes it differently. It's the concentrated, refined fructose and processed stuff that's the real problem for uric acid.
Okay. And alcohol. That's always mentioned with gout.
Oh, yes. Alcohol, especially beer, but also spirits like whiskey and vodka, and even wine to some extent, directly increases uric acid production. Plus, dehydrates you.
Ah, dehydration. How does that fit in?
Dehydration means your kidneys have a harder time flushing out the uric acid. So alcohol hits you twice more production, less excretion. A double whammy.
So we've covered food and drink pretty well. But what about other lifestyle factors? It's not just what we eat, right?
Absolutely not. Lifestyle is massive. And dehydration, even outside of alcohol, is a huge trigger on its own. Not drinking enough water simply concentrates the uric acid in your system.
Makes sense. What about weight?
Being overweight definitely increases gout risk. But here's a twist our sources highlighted. Rapid weight loss can actually trigger an attack.
Really? Why would losing weight cause a flare?
It seems the sudden metabolic shifts and the breakdown of cells during rapid weight loss can temporarily spike uric acid levels. So aiming for a healthy weight is crucial, but it needs to be gradual, steady loss.
Fascinating. Anything else on the lifestyle front?
Stress and sleep. Often overlooked, but chronic stress fuels inflammation system-wide, creating a pro-gout environment. And poor sleep. That can make your body more acidic, which also doesn't help. It's all connected.
It really paints a picture of whole body balance being key. Okay, so diet, lifestyle. Are there medical things, maybe medications or genetics that play a role too?
Yes, definitely. Certain medications are known culprits. Diuretics, or water pills like furosemide or thiazides, are common ones. They help reduce fluid but can unfortunately impair uric acid excretion. Also, some immune suppressants like cyclosporine, and interestingly, even low-dose aspirin, which many people take daily, can compete with uric acid for removal by the kidneys.
Low-dose aspirin. Wow, I wouldn't have thought of that.
It's subtle, but it can contribute. And chemotherapy drugs, due to rapid cell turnover, can cause a surge in purines and uric acid. It's something doctors monitor. And of course, there's a genetic component. If gout runs in your family, you might just be naturally more predisposed. It doesn't mean you'll get it, but it makes all these preventative measures even more important. It's often a combination of factors creating that perfect storm.
That makes a lot of sense. So given that perfect storm can strike, if someone wakes up with that classic scenario, severe pain, red hot, swollen joint, especially the big toe, what's the immediate advice?
Don't wait. Don't try to just tough it out. Our sources are clear. Consider it a medical emergency. Get it checked out promptly. Early treatment can significantly reduce the severity and duration of the attack and prevent potential long-term damage.
Okay, so you seek medical help. What happens then? How do they actually diagnose it?
Well, it usually starts with a physical exam, looking closely at the affected joint. They might order x-rays.
Can X-rays see the gout crystals?
Not usually the crystals themselves, especially early on. But x-rays are important to rule out other things like an infection or fracture and to see if there's any joint damage from previous attacks. Blood tests for uric acid are standard, but there's a catch. Levels can sometimes be normal or even low during an acute flare, so a normal test doesn't rule gout out.
Oh, that's tricky. So what's the definitive test?
The gold standard is joint fluid analysis. They use a needle to draw a tiny bit of fluid from the swollen joint and look at it under a special microscope. If they see those characteristic noodle-shaped uric acid crystals, that's a definitive diagnosis.
Sounds painful to do during an attack, though.
It can be, which is why it's not always done, especially if the clinical picture is very clear. But it is the most accurate way.
Right. So once it's confirmed or strongly suspected, what are the immediate medical treatments doctors usually turn to for relief?
Anti-inflammatories are often the first line. NSAIDs, non-steroidal anti-inflammatory drugs. Indomethacin is a particularly strong one often prescribed. Many patients with recurring gout keep it on hand. Ibuprofen and naproxen are other common options.
Because they have side effects, right?
Mm-hmm.
Stomach issues, kidneys.
Yes, exactly. They need to be used cautiously, especially long-term or in people with existing kidney or stomach problems. Another powerful option is colchicine, often known as Colchris. It works very well to stop the inflammatory cascade of gout, but it's notorious for side effects like nausea, vomiting, and diarrhea. Plus, cost and availability have become issues recently.
Okay. What about steroids?
Corticosteroids are very effective. They can be given as pills like prednisone or injected directly into the painful joint for rapid, potent anti-inflammatory action.
Downsides.
Potential side effects include raising blood sugar levels, slightly suppressing the immune system, and sometimes a rebound flare when you stop the medication. So they're usually used for short periods.
And in really bad cases.
Sometimes immobilizing the joint with a boot or even a splint or cast can help calm things down by preventing movement and irritation.
Now, you mentioned we get into some less common things. Our sources talked about laser therapy. That sounds intriguing for gout.
Yes, it's definitely more advanced and maybe not widely available yet, but low-level laser therapy is showing real promise for acute attacks.
How did that work?
Basically, the specific wavelengths of light seem to improve circulation right at the joint. This helps reduce inflammation and pain, and potentially helps flush out those irritating crystals more quickly. It's non-invasive and seems to offer significant relief for some patients. Definitely something to ask about.
Interesting. Okay, so that covers managing the acute attack. But the real goal is prevention, right? Avoiding attacks altogether.
Absolutely. It is so much better to prevent a gout attack than to have to treat one. The long-term strategy really shifts towards natural approaches and consistent lifestyle habits.
Where do we start with prevention?
Hydration, non-negotiable, number one. We mentioned it as a trigger, but consistently drinking enough water is critical for prevention. Aim for half your body weight in fluid ounces daily, roughly 8 to 10 glasses for most people.
Just plain water.
Mostly water is best. Proper hydration literally helps dilute the uric acid in your blood and makes it easier for your kidneys to flush it out. Even mild dehydration makes crystal formation more likely.
Okay, hydration first, then back to diet. But focusing on the positive, what should we embrace?
Yes, exactly. We know what to limit: the high purine meats, seafood, sugary drinks, excess alcohol. But what to add is key. Cherries, especially tart cherries, come up constantly.
Why cherries specifically?
They contain compounds called anthocyanins. These are powerful antioxidants and anti-inflammatories shown in studies to actually lower uric acid levels and reduce the frequency of gout flares.
How many are we talking?
Around 10-12 tart cherries daily, or the equivalent in juice or extract, seems to be the recommendation. Just be mindful of sugar if you're using juice, especially if you have diabetes.
Good tip. What else?
Celery is another star. Whether you eat it, juice it, or use celery seed extract, it seems to help alkalize the body and decrease uric acid buildup.
Alkali, so making the body less acidic helps?
That seems to be part of the mechanism, yes. Creating a less favorable environment for crystals. Other good foods include low-fat dairy like milk and yogurt. Some studies show they might be protective. Lemon juice in water is also alkalizing.
And vegetables, besides celery.
Potassium-rich ones are great, like Brussels sprouts and broccoli. And definitely focus on healthy fats, avocado, olive oil, coconut oil, nuts like macadamia and pecan over those inflammatory processed vegetable oils.
What about coffee? You mentioned it's a paradox. Diuretic, but maybe helpful.
Yes, it's fascinating. Despite being a diuretic, coffee, even decaf, seems to lower uric acid. It appears to inhibit an enzyme called xanthine oxidase, which is involved in producing uric acid.
So it actually blocks production a bit.
That's the theory. It just shows how complex diet is. Context matters. And just to circle back on protein, remember, it's purine content, not all protein. Lean sources like eggs, chicken breast, and lower purine fish like salmon are generally fine.
That's really helpful clarification. Okay, beyond food, what about supplements or herbs? Are there specific things that can make a difference?
Oh, definitely. Strategic supplementation can be very supportive. Vitamin C is a big one. Around 500 milligrams a day has been shown pretty consistently to help lower uric acid by boosting kidney excretion.
Vitamin C, okay. What else?
Magnesium. It's an essential mineral, helps alkalize, and plays a role in reducing uric acid formation. Look for well-absorbed forms like glycinate or citrate rather than oxide.
Right. I also saw apple cider vinegar mentioned. Seems counterintuitive for acidity.
It does, but mixed with water, it seems to have an alkalizing effect in the body and helps neutralize uric acid, just a teaspoon or two in warm water. Then there are powerful antioxidants and anti-inflammatories. Astaxanthin is a really potent one. Omega-3 fatty acids from good quality fish oil help fight inflammation and might inhibit uric acid formation. Cod liver oil gives you vitamins A and D too.
Any specific enzymes or herbs?
Bromelain, the enzyme from pineapple, is great for reducing both uric acid and inflammation. And then a whole host of beneficial herbs. Turmeric is fantastic, a natural anti-inflammatory, often compared to NSAIDs. Ginger, dandelion, cinnamon, milk thistle, rosemary, hibiscus, all have supportive roles.
Wow. And for acute relief, any natural options?
Some sources point to things like devil's claw or IPO root as natural anti-inflammatories that might help during an actual attack, perhaps alongside conventional treatment.
That's a really comprehensive toolkit.
Yeah.
Finally, let's tie it all together with those lifestyle pillars. Exercise, stress, sleep, weight. How crucial are they long term?
Foundational. Absolutely crucial. Regular exercise, whether it's HIIT, strength training, stretching, does multiple things. It helps alkalize the body, improve circulation, boosts metabolism, and is key for weight management. All good for gout.
And stress and sleep.
Non-negotiable. Managing stress reduces systemic inflammation. Getting enough quality sleep helps keep your body chemistry balanced and less acidic. Simple practices sometimes mentioned, like earthing or grounding, walking barefoot on natural ground, are even suggested by some to help neutralize body acidity, though more research is needed there.
Interesting concept. And weight management, slow and steady, is the key.
Yes. Excess weight increases uric acid production and reduces excretion. Losing weight if needed is vital, but do it gradually to avoid triggering flares. Intermittent fasting might also be a useful strategy for some, as it helps regulate blood sugar and inflammation, which can indirectly lower uric acid.
One last piece, gut health. How does that connect?
It's increasingly recognized. A healthy gut microbiome, supported by probiotic foods like sauerkraut or kimchi and plenty of fiber, seems to actually help break down and excrete uric acid. So supporting your gut is another layer of defense. So to reiterate, gout, while it can be incredibly painful, is largely preventable and definitely manageable. It requires a holistic view addressing diet, hydration, lifestyle, stress, sleep, and using targeted supplements if needed. And if we connect this to the bigger picture, understanding these mechanisms, it really empowers you. It's not just about chasing symptoms, it's about taking proactive control and creating an internal environment where gout finds it much harder to take hold.
Absolutely.
And that leads to a final provocative thought for you, our listener. Considering the broad impact of elevated uric acid, not just on gout, but its links to kidney disease, heart disease, diabetes, these major health challenges, how might focusing on these natural management strategies become a cornerstone for your overall well-being? Even if you don't currently suffer from gout yourself, adopting these principles could be incredibly beneficial for your long-term metabolic health. It's definitely something to think about. Thank you for being with us until the end of this video. Please be sure to subscribe to the What Does Science Say channel and give us energy with your likes and comments. Share your comments with us and send the video to your loved ones so that others can also use it.